Today on AllForBabies, we'll explain the 10 differences between menstrual and pregnancy symptoms. Let's see them. 1. Cramps during premenstrual syndrome. You may experience cramps quite frequently a few days before menstruation, manifesting as abdominal pain. However, in the case of pregnancy, this discomfort will continue even if your period is delayed, and the cramps will be more intense. Therefore, menstrual cramps and pregnancy cramps are usually easily distinguished. 2. Nausea. Although not a common symptom of premenstrual syndrome, if you experience nausea before your menstrual period starts, it is very likely to disappear as soon as menstruation begins, since it is related to a hormonal peak. Conversely, if the nausea is related to pregnancy, it will persist and worsen over time. 3. Abdominal pressure. Since premenstrual syndrome and pregnancy share the same hormone, progesterone, it is possible to confuse the symptoms caused by it in both situations. This differentiation can become even more complicated if we consider that changes can occur immediately after ovulation when progesterone levels in the body increase significantly. As a result, discomfort, fever, and even nausea may occur. In this context, you may be confused if you feel spasms in the belly, but your period hasn't arrived. This is when you may begin to suspect that something is happening, since the typical symptoms of premenstrual syndrome are similar to those of pregnancy. 4. Hormonal changes. Progesterone and estrogen are the hormones that have the potential to cause breast pain, particularly in the nipples. In this sense, the symptoms caused by these hormones at the beginning of the period will decrease when menstruation begins. On the contrary, during pregnancy, they can worsen and even cause other situations such as nausea. Premenstrual syndrome is a condition that causes many women to experience unpleasant symptoms caused by variations in their hormonal cycle, which can manifest both physically and emotionally and vary from one woman to another. Symptoms include extreme irritability, discouragement, headache, nausea, and back pain, all very similar to those of pregnancy. 5. Drowsiness. Sleepiness is one of the clearest signs that a woman is pregnant, although it also occurs during premenstrual syndrome. However, in these cases, it lasts for a shorter duration, between 2 or 3 days before bleeding. In contrast, when related to pregnancy, fatigue can last up to week 12. 6. Increased appetite. Hunger can be a debatable symptom since some women may completely lose their appetite during premenstrual syndrome, while in others, it may increase significantly. However, it is a fact that appetite tends to increase during pregnancy, even when nausea is present. 7. Mood swings. Pregnant women share several common symptoms, such as fatigue, irritability, anger, sadness, mood swings, decreased attention, lack of motivation for certain daily activities, and an increase in the perception of emotions, often expressed by crying. These variations in mood can also be present during menstruation, but to a lesser intensity. 8. Changes in breasts. In the case of menstruation, breast sensitivity usually disappears after the onset of bleeding. If there is an ongoing pregnancy, on the contrary, the areolas will darken, and the different veins under the skin will be more noticeable, becoming apparent for the first time in the first 2 weeks. 9. Fatigue. This is usually more intense and persistent in early pregnancies, and some women may feel exhausted even after adequate rest periods. In this sense, although menstruation may cause some people to experience fatigue as a result of hormonal changes and blood loss, exhaustion tends to disappear when the menstrual period ends. 10. Positive pregnancy test. To distinguish between symptoms of premenstrual syndrome and pregnancy symptoms, you must have a deep understanding of your body, so the only way to dispel doubts is to take a pregnancy test. Generally, it is advisable to have missed at least one menstrual cycle before taking the test for the result to be reliable, meaning you should have at least a delay. Tell us, do you still have doubts about whether you have period symptoms or if you're pregnant? See you in the next AllForBabies video.